Hello my friend, welcome to medical science class. In this student medical science, I want to that is but that is not a very yes, that is good or very bad. Now my friend, medical science class. The crisis of organ transplantation. For that purpose, somebody utilize children. That is not fair. And if you take that, how much happen? Maybe lost to people, you take the children, teach them to do that. That is criminal. Otherwise, the judicial punishment or physical punishment. But cordially, if anyone to give to organ, for example, I wanted to give to organ. In case of my wife, lover, damage to kidney, that is right. In case of other organ transplantation, I go to the loan or I have the not enough money or something like that. There is one company is enough for me. Then I give to other by money, cordially, not corruption. But in case of after death, I have so many money. In case of so many money already, everybody found from me. Then I, after my death, before my death or after my death, I give to organ, yeah, nose, heart, lung, liver. By that I got one crore taka, and that is 1 crore give to the my family member. They got 40 lakh taka for again. 1 crore taka they got. Already my gain or my loan or my expensive in our time by cordially not corruption or giving or not cost making. That is the policy. But in case of my after death, I think go to my for research purpose, for everything purpose, people should have time. People is constant and constant. Not up. And in case of after my death, my MSCOO should have died if they are alive. Then my daughter, they are not alive. My daughter, MSCOO, my daughter, and their should they not going on like and in case of organ transplantation. Wow. And already we discussed about heart transplantation, eye transplantation, ear transplantation, now brain transplantation. In case of brain transplantation, you utilize brain, forebrain. There is some portion of forebrain affected. For example, intracranial hemorrhage, cranial brain. But if you go to the nasal route, like iptamectomy, and there is a solution, slippery solution that wash the brain, clot remote. Other is there is a spinal cord. Take the fluid in the slippery solution, take out. That is the process to without brain hemorrhage, brain clot you can solve. Excellent. Now brain. In case of forebrain is not part. Those are brain dead, forebrain. And in case of forebrain, whole forebrain 90% is lost. Necrocell or dead cell. Then you go to the brain transplantation. In forebrain, then you try to forebrain connect to what to do. And cut piece of forebrain from lower part of the brain and first donor come. But before that, heart circulation, forebrain support the heart circulation. Or not. For understanding, forebrain have connection of olfactory nerve and visual area, cortex. Then you take for brain from after patient died, you alive the brain from brain and give body and take that brain and transplant that brain to this brain and lower part of the forebrain will come. But there is no diencephalon, no other problem. If mid-brain problem, then cut the lower portion of the forebrain and cut the lower portion of the hindbrain and cut the midbrain. If cerebellum is not work, you can't just cut the cerebellum and take from the donor brain cerebellum and also accessory nerve in case of donor brain. Take the accessory nerve from white matter, gray matter, also from gyrus. There is a nerve tissue, nerve cell, like nerve cell, and before that the surgical fluid or nerve communication with if any cranial nerve communication, what cranial nerve communication and visual olfactory of the and in case of medulla oblongata, at the medical but medulla oblongata is respiratory center and heart center. Before that, circulatory mission, then heart for circulatory mission, and respiratory mission for respiration, just like that. But the problem is diencephalon is corpus callosum or anything else. In case of pituitary gland already transferred in the if transplant to forebrain, midbrain, hindbrain, if transplant to what we say, if there is a problem in diencephalon, then you cut the corpus callosum and take out the diencephalon and dismiss, take the recipient diencephalon, connect that, and also accessory nerve take to the recipient brain and connect and separate, just like that. Just simple policy to brain transplant and brain. And after transplant, do not open the brain of God. When everything is okay, vital sign is normal okay, and 1 week pass, no problem. Then skull there, then skull and skull close. By that transplant brain, take from donor consent. Before death, we give consent and give royalty to his family or his or her. In case of brain, in case of blood connected, if anyone die, then if suffer the traumatic brain, that kind of situation, blood connected, that is easy to connect. If give royalty, we give the same. Now my friend this work, if you do cordially, that is fair. But in case of private organ, that is not fair. You private organ and if you white private organ, there is a chance of fine. In case of private organ, hot. But damage of private organ, correct. By muscle, release of muscle, say, just like that. Just like that in case of brain transplantation and in case of other organ, autograft, allograft, xenograft. And organ transplantation, skin transplantation, auto, allo, xenograft. In case of organ transplantation, autograft. What is the autograft? Autograft, if any nerve is problem, take the accessory nerve and connect them, refill them, auto transplant. Any muscle tissue, what is the private organ damage, you take to the muscle and shape the private organ by the help of the and follow from other. You have suffering any disease, 2 kidney loss, your wife have 2 kidney recorded in one. Okay. Husband lost 2 kidney, wife 2 kidney. And in case of xenograft, husband wife is not agree and suffer and patient mother to not agree. Then go to the animal, valid animal, goat, sheep, kidney, goat kidney, valid animal, kidney, heart. That is xenograph. That is xenograph. And on xenograph there is a chance of graft restriction. But graft restriction and transplant there is a chance of graft restriction and others created fermentation complications. Very much a lot about that. And so graft restriction in order to substitute agent to utilize. And in this graft restriction, it's fine. Now my friend was about that is in case of xenograph, that is still we go to the kidney already. I see that. But why not valid animal? In case of there is a unvalid animal also which is valid animal not found. But in case of unvalid animal there is a chance of graft reaction. And in case of valid animal there is a less chance. Valid animal should have less chance to graft reaction or reaction. And because we are eat them and create a benefit for us, but valid animal is not more than the animal. Just like that. Thank you very much for friends. Also in case of blood, animal blood, if blood is not available, then go to the animal blood and valid animal blood for survival. Fine. And transfusion medicine, blood transfusion. I have the immunity. My wife has not that disease immunity. What do you need? That's the wife. Take the immunity. Just like that. Thank you very much, my friend. Supported today is Anna from Medical Science Labs. I am representative of MSc and MSCOO7 version as per I know. How much patent by yeah, Aditya, yellow shirt, yellow, yellow. Another short, that is the